So we are at 6:04 India time, and we have a good number of participants in all our platforms. We are on Facebook Live also today, and this is an event where we are directly doing it on Zoom. So with these few words and the topic of the day, specifically on blood pressure and how to reduce it without medication, has been something which will be extremely interesting for all of us. So without much ado and without much speaking from my side, let me invite Dr. Susheel Sharma, who is already there with us, joining us from US, Maryland, and we would like to hear from him directly his views and the concept what he has with his vast number of years of experience he has been able to put forth, and I'm sure all of us are going to get huge benefited through whatever he's trying to communicate to us. So over to you, Dr. Sharma.
Thank you, Namaskar. Thank you very much. That was a kind introduction, and good morning and good evening and good day too, depending upon wherever you are. So today we're going to do one segment of the lifestyle disorders, and we are going to talk about high blood pressure. Now, high blood pressure, you may either have it or your family members or parents or grandparents may have it. So you know about it. If everything that I'm going to talk today, everything you forget, but if you remember three things, I think that you've done yourself a service. Number one thing, once you finish this talk and go away, remember for the rest of your life that blood pressure is a silent killer. It may not give you a lot of grief. Your blood pressure may be 170, 180, 190, or 200, and you may not notice any symptom. But over a period of time, it is causing changes in your system that then leads to shortening your lifespan. So that's number one. Remember, blood pressure is a silent killer, and therefore you must take care of it. Number two, sometimes there may be a cause for blood pressure, 4 to 5% of the time. 95% of the time, your doctor may tell you, yeah, you have blood pressure, your father had blood pressure, your mother has blood pressure, there's no cause for it. Well, we disagree. We think lifestyle is the cause. And that's number two thing you need to remember. The number three thing you need to remember is that if you transform that lifestyle in a scientific manner, as we recommend based upon our program, you can either prevent or cure or treat your blood pressure without medicines. I'm not asking you to stop your medicines. Keep taking your medicines for now, and also join IWSP and do the program and gradually make the transition. Over a period of time, your medications will go down and your blood pressure will come down, and you can either come off of medications completely or reduce them. So remember these three things. One, blood pressure is a silent killer. Therefore, no matter what, you have to bring it down if it's high. Number two, it's a lifestyle disorder. And what is lifestyle? Lifestyle is the way you live, the way you move, the way you eat, the way you think. And if you change these four, you change your lifestyle. And by changing lifestyle in a structured, scientific manner, as we have put together and packaged in this program, you can either prevent, control, or cure your blood pressure. Okay, so I thought, let me get the meat, the gist, the butter out of the way, and then we'll talk about rest of the things. So let me share my screen with you. So I already gave you a brief description of lifestyle disorder. This is one of the lifestyle disorders. And one thing you need to remember is this. Remember this 80% rule. And what is this 80% rule? The 80% rule is that 80% of us at some or other time in our lives will have this lifestyle disorder. So what are these lifestyle disorders? High blood pressure, overweight, dementia, chronic kidney disease, heart attack, high cholesterol, diabetes, stroke, and some cancers. These are all lifestyle disorders. You may think, oh my God, there's so many illnesses, and you see them all around you in general public, in your family, friends, you hear it all the time. And Dr. Sharma is telling us that they're all lifestyle disorders. And 80% of us, 4 out of 5, including myself, will have one or more of these at some or the other time in our lives. So this tells you about how prevalent this is. Well, one more thing you need to know, 80%. Some of us may die from an accident, okay? Some of us may die for some other cause, but 80% of us will eventually die because of a direct or indirect consequence of one or more or all 8 of these disorders. So for example, I may die of a heart attack one day. Yes, lifestyle disorder. Or I may go into kidney failure, may get a kidney transplant, it may not work, and I may die, lifestyle disorder. I may have diabetes, I get complications of diabetes, I get severe infection, I get kidney failure, I lose my vision, I get septicemia, and I die from septicemia. But eventually, it was diabetes that led to it. So the cause was lifestyle illness, or I may die of stroke or some cancers. Also, if you really look at how the health budget is done, and this is especially data from Medicare from the USA, 80% of our health budget is spent on managing these 8 disorders or their consequences. If you really look at, you go to your grandfather and go to your grandmother sometime and look at all the medicines that they're taking, almost all of them may be taking 1 for the blood pressure, beta 2 for the blood pressure, 1 for the cholesterol, 1 or 2 for the diabetes. So 5, 6 medicines that they're taking, because these are lifestyle disorders clustered together, and lifestyle causes 1 and more of these disorders depending upon how you lead your life. And then they have to take all these medications, which are expensive, doctor's visit, blood tests, hospitalizations. And if complications happen, then procedures and surgeries, right? So all these expenses, if you add up, because when you're in your 10, 20, 15, 30 years old, you hardly spend anything on your health, right? There's hardly any expense. It's only when you get to the latter part of your life and you get these lifestyle disorders and they start causing complications and physician visits and all that, that's where the money is spent. So 80% of an entire health budget will be spent on these disorders. So imagine how much money you could save by preventing these disorders. And blood pressure is one of them. But now the good news. The good news is that 80% of these 8 lifestyle disorders can either be managed, cured, or improved with scientifically proven methods for lifestyle transformation. The methods have to be scientifically proven, not somebody's gut feeling. Scientifically published in world literature, shown to make a change by changing the lifestyle in these disorders. And that is what our program is. And that is how we manage these lifestyle disorders. So this is a bit of good news that 80% of these lifestyle disorders can be cured, managed, or improved. Okay, so blood pressure. So what is blood pressure? Let me just first go in a very layman terms. The many types of pressures you know, right? Your car tire has a pressure, right? You put air in it, and that's pressure. You need that to keep it inflated. Now, you also know that too much is not good and too little is not good. There's an optimal pressure depending upon the size of the tire and the size of the vehicle. They recommend 40 psi, 36 psi, 46 psi, right? And psi is a measurement of the air pressure in a tire. Now, same way in the body, there are blood vessels and the blood flows in them, and there's a pressure that it flows under, and we call it blood pressure, which we measure in millimeter of mercury. Now, how does the blood flow? So let's first take the example of a building. You live in a 5-story building, right? For the water to reach fifth floor, you need a pump, right? Something to pump blood up because it has to go against gravity. And that is the function of the pump. And the equivalent of that pump in your body is your heart. So that's one thing that is required for blood pressure. The second thing is the pipes. The water cannot reach the top of the building just by the pump. It has to go through the pipes. And these pipes are the blood vessels. So in your body, exactly the same way, there's a pump, which is heart, which pumps all the time, right? And there are pipes through which the blood runs. Now, when the blood runs through these pipes, it runs under pressure. If there's no pressure, the blood cannot go up because the gravity will pull the blood down and all the blood will go in your feet. That pressure, 120 divided by 80, 120 over 80 millimeter of blood pressure is called the normal blood pressure. So why do we say 120 divided by 80 or 120 by 80? Well, you have to think about it. When the heart pumps, when it squeezes, the Latin word for the squeezing is systole. So when the blood squeezes, there's a higher pressure, and that's the upper pressure. It is called systolic pressure. And then for the heart to pump, it has to fill again, right? So it relaxes and fills. The relaxation of the heart is called diastole. So during relaxation also, some blood flows, although not at such a high pressure. And that's lower pressure is called diastolic. And that is why we say you need two pressures. One when the heart squeezes, one when the heart relaxes. And this is going on all the time. Systole, diastole, systole, diastole, systole, diastole. So systolic pressure, diastolic pressure, systolic pressure, diastolic pressure. Both are equally important. You have to keep systolic around 120 and diastolic around 80. Okay, so we are on the pipes, right? You understand if something flows in the pipe, the flow is a function of the quality and the quantity of the liquid flowing in the pipe, right? So if, let's say, you have a pipe through which very corrosive, dirty water goes, this pipe is going to rust, corrode, and going to get damaged. It's exactly the same way. If the blood that is flowing through your arteries is not good, loaded with fat, loaded with sugar, loaded with salt, what is it going to do? It is going to corrode the inner lining of your blood vessels. They will lose their elasticity. They will not be able to accommodate higher pressure, and the blood pressure will go up. So this is how you make a connection between a poor diet full of salt, sugar, and fat, eventually contributing to damage to the inner lining of the blood pressure, the blood vessel, and causing high blood pressure. So that's the quality of the blood. Quantity also matters. Generally speaking, in our body, we have 5 liters of blood. And this 5-liter blood is moving in a closed space by this pump. Now, those of you who have done physics will know what will happen if I expand this volume from 5 liters to 6 liters. Same blood vessel, closed loop, same heart, same body. From 5, it became 6. Now, when the volume increases, some of you may remember from physics, pressure is also a function of the volume. So when the volume increases, the pressure has to increase. There's a greater volume to push through. So how does the volume increase? Let's say you have 5 liters of blood in your body and you consume 10 grams of salt. Now remember, 10 grams of salt can come from actually 3 slices of pizza, right? Now this 10 grams of extra salt or sodium that went in your body, got absorbed, got in your bloodstream. It raises your sodium levels. Sodium is generally kept around 130 to 135 milligrams level. Now, if the sodium goes high because it's dangerous, what does the body do? Body will say, okay, let me get some more water in to dilute this sodium so that I bring the level down to 130 to 135 milligrams. So how does the body dilute? Body dilutes by preventing you from losing fluid by not peeing out or sweating and by increasing the blood volume. So if you took more salt, the consequence of that is sodium went up. Sodium went up, you retain more fluid. You retain more fluid, you increase the blood volume. You increase the blood volume, you increase the blood pressure. So that is how sodium or salt is directly correlated to blood pressure. Okay, so it is a continuum. So one more thing, remember I told you 3 things to remember when you go away from this talk, and if you forget everything, one, I told you it's a silent killer. Second, it's a lifestyle disorder. Number 3, it can be cured or prevented or managed by changing lifestyle. I want you to remember one more thing. For every 1 millimeter rise in your blood pressure above 120 millimeter of mercury, your risk of stroke goes up by 2%. So if your blood pressure goes up by 25 millimeter and stays up at 145, 150, you have a 50% chance of getting a stroke compared to a normal person. So this is how exponential the risk of getting the complications from the blood pressure is. And that is why I say it's very important to treat it. So now this is controversial, what I'm showing you right now, because this is the new data that has come out. This is the latest recommendation from the Hypertension Society of America. And this is also from the American College of Cardiology and American Heart Association. This came out in 2017 and still holds true today. There has not been a revision. And there was a huge hue and cry when this came out. Why? Because look at that yellow segment, which says from 121 to 129 systolic is elevated blood pressure. So what did this mean epidemiologically? What this meant was that 1 in every 3 Americans has high blood pressure. Now, the critics said, oh, well, this is a plot by pharmaceutical industry to push medications to bring the blood pressure down and sell their medicines. So these are the skeptics who interpreted it this way. Well, this is based on science. It's based on science because every 1 millimeter rise in blood pressure above 120 has a consequence. So I look at it differently. I look at it, it doesn't matter whether it's 129, 139, 140, or 150. I can lower this blood pressure by lifestyle. So I don't think it's pharmaceuticals pushing this because I'm not taking pharmaceuticals. I am doing lifestyle change. So it's a good information to know that you have to keep your blood pressure below 120 systolic or 80 diastolic. If you are 120 to 129 systolic, you are elevated blood pressure. So if you're 130 to 139, it's already called hypertension stage 1. Now, most people, those who are listening in India or some here going to their primary care physicians may know that usually physicians start medications if the blood pressure is 140 or higher systolic or 90 or higher diastolic, which is actually stage 2 of hypertension. You've already gone way beyond. So what 10 years ago we used to say 140 over 90 is normal blood pressure, now is stage 2 blood pressure. So try to understand this. It's very important for you to know that anything above 120 over 80 should alarm you. You need to change something to bring your blood pressure down. Don't procrastinate. Don't sugarcoat it. And please don't do, I've been treating blood pressure for 40 years with my patients. They come in and the blood pressure is 150 over 94. Well, doctor, this is unreal today. Remember, I drove 20 miles to come here. I couldn't find the parking. And before I came in, I couldn't find the gas station and I was frustrated and my credit card didn't work. And at work, my colleague was not very good to me. At home, I had some argument with my wife. Last night, I had some argument with my son. These kind of things normally don't happen, doctor. When all these don't happen, trust me, my blood pressure is normal. Then I ask them, how many times does it happen the credit card didn't work or the gas station or the argument or colleague or all that? Every day, one or the other thing happens in our life which is stressful. So don't just sugarcoat it. Don't just blow it under the carpet. Don't procrastinate. If your blood pressure is 150, it is 150. It is causing damage to your heart, damage to your body. Now, there may be a secondary cause, a stress. But the important thing is you are being damaged. So you either have to learn how to control stress or bring this blood pressure down. And that is what we tell you. We tell you lifestyle to bring the blood pressure down. And we tell you how to manage your stress so that it does not affect your blood pressure. Okay, so we discuss in detail what causes high blood pressure, but I'll just enumerate here one more time. 5% of the time, there is a what we call secondary cause. Secondary means either some endocrine disorder, such as high aldosterone levels or cortisol levels, or some kind of chronic kidney disease that can cause blood pressure. So that's about 5% of the time. In 95% of the time, there is no such cause, and that is what we call as essential hypertension or primary blood pressure. And the doctor will tell you, well, your father had it, your mother had it, and therefore you have it. And when you become older, you have a chance of having it. Yes, it is primary, it is essential. There is no cause for it. But remember, I told you there is a cause for it. Because if you change your lifestyle, this blood pressure goes away. If the blood pressure goes away with the change of the lifestyle, then lifestyle was the cause of the blood pressure. So what happens? See, there are blood vessels going in every part of your body. The blood vessels going in your brain, right? If they become narrowed, constricted from high blood pressure, the inside gets corroded or damaged, you have memory loss, you can have strokes. If the blood vessels going to your heart do not provide enough circulation, you can get heart attack, you can get enlarged heart, you can get heart failure. If the blood pressure causes the blood vessels going to the kidney become damaged, then you get kidney failure. If it causes problem to the arteries going to your legs, then you get peripheral vascular disease, because these blood vessels are going everywhere, and the pressure inside the blood pressure determines the quality of the blood vessel. If the pressure is high, the quality is poor. If the quality is poor, the appropriate organ which is being supplied by these blood vessels will suffer the consequence of that problem. Okay, so how to control, prevent, and cure blood pressure? There's no doubt you have headache, right? You check your blood pressure, you have high blood pressure. Your doctor says, okay, I checked your blood pressure and it's 145/90. I think I have to give you a medicine to treat blood pressure. Simple. You go there, it writes a prescription, you take home, you start taking one medicine. Well, sometimes it may not be 145/90. It may be 160 or 100. So remember, one medication for blood pressure that your doctor prescribes lowers your blood pressure by 10 to 15 millimeters of mercury. So if you're 145, you take one pill, you come down to 130. But if you're 160, you're going to end up needing two different types of medicines, because remember, each one lowers by 15 millimeter. So to bring it down from 160 to 130, you will need two medicines. Now, if it is 175 or 110, you will need another medication. So if your blood pressure goes to that range, you're taking 1, 2, 3 different medicines. Now, some of you might say, okay, doctor, that's fine. I have high blood pressure. I can take one medicine. I can take 2. I can take 3. Bring my blood pressure down to 120 or 80. Why should I worry about your lifestyle? Right? Well, there are many reasons for that. Number one, when you take medicines, you're spending money. Number two, when you take medicines, you're making frequent visits to the doctors and getting blood tests. You're spending money and time. And when you take these medicines, you're spending money, spending time, and you're suffering the consequence of the side effects of these medications. So I'll tell you a very simple thing. The most common medicine used to treat blood pressure is called hydrochlorothiazide or chlorthalidone, or in short, we will call it diuretic. It is called diuretic because it removes sodium from your body. And remember, I told you, when the sodium goes in the body, salt goes in the body, water goes in the body, blood pressure goes up. So the theory here is that if you remove the salt from the body, right, and you bring the volume down, you treat the blood pressure. Very good, excellent medicine. It works 100% of the time for bringing the blood pressure down by 10 to 15 millimeters of mercury. So let's say you say my blood pressure 140 or 90, doctor. I don't want any lifestyle change. I don't want to restrict my salt. I will just take one hydrochlorothiazide. You're telling me zero salt or no salt, and I'm getting the same thing by taking a medication. You can take this medicine and take the salt out of the body, and then I can eat my samosa, I can eat my chaat, I can eat my salty food, everything, right? What's wrong with that, doctor? Right? You can ask me that question. Here is the problem. Hydrochlorothiazide is a medicine that reduces sodium, reduces blood volume, treats blood pressure, but every effect that a medicine has, there's also, along with it, there is a side effect. So let's say you took hydrochlorothiazide and 6, 7, 8 months later, you went to your doctor and the doctor says, now your blood sugar is high. You say, oh, blood sugar high, what happened? Doctor, nothing changed in my life. Why should my blood sugar go up now? Well, I didn't tell you when I prescribed hydrochlorothiazide that 10 to 15% of patients can have hyperglycemia as a side effect of hydrochlorothiazide. So it is a side effect of this medicine that you're treating for your blood pressure. But the medicine is doing very good for your blood pressure. So don't worry about it, okay? Keep taking your hydrochlorothiazide. This side effect of hyperglycemia that has come, I will give you one more medicine called metformin, and they'll bring your blood sugar down. And I'll give you glipizide, and they'll bring your blood sugar down. Now you're up to 3 medicines. You go back to him 2, 3 months later, your blood pressure is okay now, and your diabetes is okay now. And he says, well, your triglycerides are going up. He says, doctor, why is that? Nothing has changed. My diet is same. I'm exercising. I'm taking medicines. Well, I didn't tell you that actually hypertriglyceridemia happens in 10 to 15% patients that take hydrochlorothiazide. So it's a side effect of a medicine. But don't worry about it. I can give you fenofibrate, 145 milligram. Here's a pill, take it, and your triglycerides will be fine. So now you're taking hydrochlorothiazide, you're taking metformin, you're taking glipizide, and you're taking fenofibrate, right? 4 medicines. Everything is fine. You go back 3 months later and say, doctor, I have this severe pain in my right big toe. What is this? And I can't even touch it with my socks. It burns. And he looks at it, it's inflamed, it's red. Oh, this is actually gout. It's gout. Gout? I never had gout. I never had any problem called gout. Well, I didn't tell you this, but 10 to 15% of patients have a side effect of this medicine, hydrochlorothiazide, called hyperuricemia. It makes your uric acid go up. So he checks your uric acid, it's 10 milligrams. So, well, here it is. Take some Motrin to bring the inflammation down, and take this colchicine and take this medicine to bring the uric acid down. So now you're taking 1 for blood pressure, 2 for diabetes, 1 for triglycerides, and 2 for gout. You're up to 7 medicines. Now, let's not go further, because each one of those medicines that you're now taking have their own side effects. And they'll explain to you why your 70, 80, 90-year-old grandpa or grandma every morning picks up like 8 or 10 medicines and pops them up. So is that what you want to do? If you want to do that, perfectly fine. But I think the very reason that you logged into this program is this is not what you want to do. You belong to the other group. The other group says that why can't I change my lifestyle and bring this 145 or 90 to 120 or 80 at the first place to avoid all these that I went through, the medications, the effects, side effects, testing, and all these consequences and complications, right? So this is a slide that I got modified from American College of Cardiology, American Heart Association. This actually will open your eyes. So please stay with me and pay very close attention. Every 1 kilogram weight that you lose drops your blood pressure by 1 millimeter. So that's 5 millimeter of blood pressure you can lose by losing 5 kilograms. It's good to lose more, but you don't lose more blood pressure after that. If you change to the diet, what we call scientifically proven diet that we recommend in our IWSP program, you lower your blood pressure by 10 millimeter of mercury. Remember when I showed you the effect of medications? 1 blood pressure medicine lowers the blood pressure by 15 millimeter of mercury. So by losing 5 kilo weight with our diet and taking our diet, you lost 15 millimeter of mercury. So if you were taking 1 medication for blood pressure, because your blood pressure was 145 or 90, that medication is gone. Okay. If you bring your sodium, salt, down to less than 1.5 grams a day, your blood pressure goes down by 5 millimeter. If you replace to potassium salt, and we'll discuss in detail how to do that, don't just go ahead and do it without actually attending the program, because some people can be hurt by it. You lose another 5 millimeter. And if you do 20 minutes aerobic exercise a day, you lose 5 millimeter. So 5 plus 5 plus 5 is 15. So now one more medicine gone. So if you're taking 2 medications and you did our program and learned the diet, the proper way of salt restriction, potassium, exercise, weight loss, 2 medicines are gone. Okay. If you did dynamic resistance and isometric resistance exercise, each one makes you lose 5 millimeter. And if you quit alcohol, it makes you lose 5 millimeter. So that's another 15 millimeter. So think about it just by doing a lifestyle change as we recommend. And we'll tell you in detail what is aerobic, what is dynamic, what is isometric, and how to do it. You lowered your blood pressure total by 40 millimeters of mercury. That is like giving up 3 medicines. So you have a choice. You have a choice to attend our integrated wellness science and practice program. Learn the scientifically proven techniques published in scientific literature that treat blood pressure without medications and have a healthy lifestyle. Now, that healthy lifestyle that I'm talking about that brings your blood pressure down also brings your cholesterol down, also brings your obesity down, also cures your diabetes, also prevents heart attack, also prevents stroke, chronic kidney disease, dementia, and some cancers. All 8 lifestyle disorders are affected by that. So IWSP stands for Integrated Wellness Science and Practice. Together with Dr. Deyadeepananda, Swami Deyadeepananda, who is the superintendent of the hospital, Ramakrishna Mission Hospital in Kankal, where we did this experiment for the first time. For 30 days, we created a program, and 2 of us together did it on ourselves to see what it does to our blood pressure, our cholesterol, and our numbers. And that is where it was designed. I stayed there for 1 month in India. And we picked up only scientifically proven techniques, which are published in world literature, and added to that some ancient wisdom of India, which includes the meditative practice, stress resilience, pranayama, yogic exercises, and combine the 2. We do not give any concoction. We do not give any medication. We do not give any puria. We don't sell anything. We have no oil, nothing. We're not selling you anything. We're giving you scientifically proven methods of lifestyle transformation for prevention of lifestyle disorders. And we created this program together with Anirbanji, Subratoji, and Nareshji. And now we've successfully done at least 6 of those. 7th, we are starting on January 16th that we want you to join. And over 500 people have been benefited from this. So how can you join? You go to our website called myiwsp.com, and you just log into that and click on, I will join the program. It walks you through and it'll take you to the program. The first lecture you must attend. It's introductory and free. I give in detail a detailed analysis of how the lifestyle disorders come into being, what is the role of your lifestyle, your inflammation, your dietary habits, your stress levels, your habits, all contribute to that. And then we go through that program, and in short, we call it DASH. And the DASH stands for diet, activity, stress management, and habit change. Now, habit change, think about it. If you have a poor dietary habit, it's a habit. If you're not exercising, it's a habit. If you do certain things that bring you stress in lives, it's a habit. Now, you can change habits, but only if you follow scientifically proven principles. Now, you must have gone through this. I've gone through this, and it's an ancient saying. So many times we know what is the right thing to do, but we cannot convince our mind to do the right things. And so many times we know what is the wrong thing that we should not do, but we cannot prevent our mind from not doing. and that is habit. Habit is what overrides our rational decisions of life, reasoned decisions of life. So we discuss in detail how they come about and how you can change them. And there'll be excellent yoga exercises, pranayamas that lower blood pressure, along with guided meditation that lowers blood pressure with Swamiji. He's also, as I told you, a physician trained in yoga and in modern science. Now, one word about meditation. And I say this, and this is one more thing I want you to go away with. And I say this in every talk that I give. I tell that the 20th century belonged to medications. The 21st century will belong to meditation. Meditation is the most powerful medication. It's amazing how much it lowers your stress level. It's amazing how it actually empowers you to change your habit. It's amazing how meditation helps you to improve your activity and sleep and diet and improve these lifestyle disorders. So I hope that you like this brief introduction. I kept it very brief. It's just an introductory. We're going to have 7 or more of these on different other lifestyle disorders. But once you come and join us on January 16th through 12 modules that we do spread over 3 weeks, 1.5 hours every day, 45 minutes of lecture and didactic and question and answer, and 45 minutes of live asana, pranayama, and meditation. We actually hold your hand and take you through each asana, each pranayama, each meditation. At the end of 4 weeks, you'll be expert in the asanas and pranayamas and meditation that we think you need to know for lifestyle change. We're not claiming that we're going to make you a yoga expert, but we are going to give you the yoga, pranayama, and meditation that is needed to reverse lifestyle disorders. So thank you very much for listening, and I'll take some questions now.
Thank you, Doctor. I will take those questions, and perhaps that will we have a few questions, Doctor, and I'll just take it. I'll stop the sharing here. Yes, Doctor. So we have Suman asking how to reduce BP instantly.
Okay, so if you have to reduce blood pressure in 1 day, 6 hours, or 2 days, you need medicines. So instant reduction is medication. If it's an instantly high 200 millimeter blood pressure, you go to the emergency room and they'll give you intravenous blood pressure medicine that will bring your blood pressure down in 30 minutes. If you need to lower in 2 to 5 days, then you can start taking pills. So that the quickest way to lower blood pressure is by medications. And once you're lowered it and controlled it, and then you make your lifestyle change. Lifestyle change takes about 3 to 4 weeks to start kicking in. And slowly and gradually, as you intensify your effort that you're doing in changing lifestyle, and that lifestyle brings about the required change in your body, in your endothelium, the quality of the blood that flows in your body and the quality of the blood vessels, gradually over a period of several months, you can eliminate those medicines.
Great, Doctor. I think, I mean, the instant one is perhaps the challenge one, I mean, which is only when it comes to emergencies, but then the one which you talk about, and we all have benefited from it, we being the people who manage this event, but we all are, a great proponent of your ideas and thought process, and we all have benefited. So that's the reason we are so confidently talking to everybody and trying to bring everybody on board when it comes to these practices. So another question is, other than salt, any other food has a direct link with blood pressure?
Yeah, we have 2 full sessions, 3 sessions on food. The food that improves blood pressure, the food that improves heart attack, the food that improves stroke. Yes, there will be 3 full days of different dietary components that impact the blood pressure positively or negatively, the ones that you need to maximize, the one that you need to minimize, and the food that you need to avoid. Yes, there'll be a detailed discussion on that in the program.
Absolutely, doctor. And as far as I remember, I think you not only speak about the food, the timing, the manner in which the food has to be taken in, the exact, the specification, the number of times it has to be taken, fasting, a lot of great ideas. I'm sure. I mean, if we implement even 20% of what ideas you share, I think we'll all be much better than what we are today.
So we're
So
not just talking about what to eat and what not to eat. That you will hear many
yeah,
places.
yes,
We're also talking about when to eat, when
correct,
not to eat, how to eat, and how not to eat. That
correct.
also has an impact.
Absolutely, doctor. And this is a great differentiator which I have personally seen between your program and the ones which others do. Then Mr. Crispin is asking, normal BP value will differ from various age groups. Is the BP level differs between female and male?
In male and female, not so much, but you're right. And there's a group called systolic hypertension of the elderly. So in elderly people, when you're 70 years old and over, the definitions change a little bit because they generally have a higher systolic blood pressure. And whatever you're taking in an adult, you add to that 10 more millimeters and call that
Okay.
normal.
Okay. So, I mean, the normalcy changes as you grow older. I mean, the
Yeah,
requirement.
beyond certain age. But for the present discussion, because we're all sitting here at least less than 80 years old and we're
Yeah,
all more than 30 years old.
yeah,
For us, it's the same.
absolutely. So then there's a question on where do we get potassium salt
Yeah.
is being
So
spoken about.
before I tell you this, again, as I said, we'll discuss that in detail when we do the program. There are certain people that should not take potassium salt. And what kind of potassium salt to take and where to get from, we'll discuss in detail in the program. I don't want to just throw it out there and you start taking it and you end up hurting yourself because not everybody can take potassium salt.
Okay, sir. Then one more question from someone is, do you recommend IWSP diet to be followed for younger, very young children also? She is mentioning an age of 2 years or
Yeah,
so.
because see, we all live in a family, right? We all have most of us actually. We have a family, a husband, wife, brother, sister, children, and all that. And I don't know about your household, but in 99% households, it's one meal that is cooked for everybody. So if you are eating healthy, by default, same thing is being eaten by your parents and grandparents and by your children. Same diet. And it is a healthy diet. It is a healthy diet. Now, you understand the scientific basis of this and the benefits, and therefore your compliance is higher than the compliance of a child. Because when we are 10, 12 years old, 10 or 12 years old, we are more driven by our likes and dislikes and what our palate likes, and not by what is healthy. Because when I'm 15-year-old, what do I know about disease? So yes, there'll be some difficulties, but you can make some changes for children and make it a little more palatable for them. But it's the same food, same healthy diet.
I think the concept of family, I think you explained it nicely that, it has to be uniform. And I think the diet applies for everybody in slightly tweakable format.
Yes.
So one more question, can inflammation in any part of the body increase blood pressure?
Absolutely. So I actually devote one full session on inflammation. Inflammation is very close to my heart. Actually, most of the deposition, 50% deposition of all these bad things that I talked about that deposit inside the arteries called atherosclerosis comes through the mechanism, but half of it comes from inflammation. So inflammation is becoming a huge part of health now. If you can avoid inflammation, you can avoid lifestyle disorders. I actually devote one full 60-minute session to inflammation, how it happens in the body, how you can tame inflammation, how inflammation exaggerates not just by what you eat, but the way you move, your activity level, how inflammation increases by stress in your life, how inflammation increases by certain habits in your life. And we discuss that in detail. So I can't really say in 2 minutes. I need at least 50, 60 minutes. And I tell you, of the entire IWSP that I do, I know Naresh is listening. He keeps laughing when I say that. That is my favorite topic, inflammation. And remember, going forward, 10 years from now, 20 years from now, you will even see doctors who are only treating inflammation.
And that will become a specialized field
Specialty.
of medicine. Yep. So, Doctor, one more question, comment also from Mr. Bharat. He says that, Dr. Sharma, always a pleasure to hear you. If a person using BP medicine follows DASH, can the medicines be avoided?
Yes, but as I said, it's a gradual decrease as you, because blood pressure, you have to have a good blood pressure instrument at home. First of all, if you have high blood pressure, you take medicine, it behooves upon you that you buy a blood pressure instrument. Now, I don't know how it is in India, but in America, I tell my patients, buy Omron. That's a good standardized blood pressure instrument. And I also tell my patients, don't buy the instrument which is less than $50 because they're not accurate. And also make sure that whatever you spend on that, every 3 years you change, because the diaphragm and the calibration of these are machines, it changes. So every 3 years, even if your blood pressure instrument looks spick and span and beautiful and clean, throw it away and get a new one, because they don't last more than 3 years. Accuracy goes down because you're not standardizing them, you're not recalibrating them. So anything that measures pressure requires constant calibration. And because we're not calibrating these instruments, at the end of 3 years, you should throw them away. So keep a blood pressure instrument, check your blood pressure, take your medicines, and do a lifestyle change. You will see that your blood pressure is gradually coming down. So if you gradually come down to like 110 systolic, now you know full well that one medicine lowers blood pressure by 10 to 20 millimeter of mercury, and I'm taking 3 medicines. If I'm 110 systolic, I can eliminate one. You eliminate one and your blood pressure comes to 120, which is still fine. And now you've done the lifestyle change, and again it comes down to 110, then you know it's time to take away the second medicine. Then again, you take second medicine and keep changing lifestyle. And again, your blood pressure comes down to 110 systolic. Well, it's time to take away the third medicine. So you do that over a period of 3, 4, 5, 6 months.
Absolutely, doctor. A few more trickle questions are trickling in, I would say. There are people who ask about, is blood pressure a hereditary disease?
Yes, there is a complex inheritance, and therefore we really say familial. We don't say heredity, because there is no direct single gene transmission of blood pressure in the families. It is polygenetic and familial. If your father and your mother both had high blood pressure, there's a very high chance that you will also have high blood pressure. Both because you inherit the same familial polygenetic makeup, and also your lifestyle. You may not, although you got married, you moved away, but a greater part of your life was actually with those same people. So you may not know this, but at subconscious level, a lot of your health habits, dietary habits are actually the same that you did when you were a child living with your father and mother.
Absolutely. So familial is the right word. How thin people can have high cholesterol?
So remember, when you really tease out the cholesterol, okay, number one, the 20% of cholesterol is dietary, 80% is manufactured in your liver. So even if you are not consuming high cholesterol diet, if there are certain problems in your liver, you can manufacture more cholesterol. And there is no correlation between obesity and cholesterol. I have had patients 450 pounds with normal cholesterol, and I've had patients with 110-pound weight with high cholesterol. So it's not a function of obesity. It's a function of how high your diet is in cholesterol that you consume. So it's both dietary and also it's endogenous. And 80% of cholesterol actually is created in your body.
Okay, that's great. I think endogenous, by you mean endogenous means the body is producing cholesterol on its own.
Yeah.
Okay. So
remember, cholesterol, there's a certain ring. Those of you who've done organic chemistry will know it's called cyclopentanophenothrin ring. It's a special ring compound, which is the base of the cholesterol. That base actually is the base of several hormones in the body. Your estrogens, your progesterones, your testosterone, all these hormones that are produced in the body, the precursor for that is cholesterol. So cholesterol is a good thing for the body to manufacture those hormones. But when it becomes excessive and deposits in the arteries, that's when it wreaks havoc.
We'll have a separate session on cholesterol like this, so we can go deep in that.
Yeah.
Absolutely. So one more question is, has a glucometer also to be changed?
So remember, those of you who are mechanic, I'm not a mechanical person. I'm not a physics person. I'm not an engineer. So actually 3 of you are facilitators sitting here, engineers, then you know it. Everything that gives you a measurement and a reading needs calibration and fine tuning.
Yes.
So, and if you're not doing it, if your glucometer is not being tuned and calibrated, their lifespan is 3 years.
Absolutely. No, I fully agree with you, sir. Then your medicinal science perspective, what is the composition of the BP tablets and how it reduces BP? I think you mentioned it in your talk. So I would recommend, Mr. Bharat, that you can go to Facebook and you can have the Facebook Live, because this is going to be in Facebook Live. So you can watch the entire session of Dr. Sharma once again. If you would like to shortly comment, Doctor, on this.
There are several different groups of medications. Since our emphasis is not on medications, our emphasis is in stopping medication. So I don't want to go in detail, but there are 5 or 6 different classes of antihypertensives. You pick one drug from each class. Each reduces blood pressure by 10 to 15 millimeter of mercury. Yeah. Diuretic is hydrochlorothiazide, beta blockers, ACE inhibitors, or ARBs, or direct vasodilators, or central drugs like clonidine, hydralazine. So there are different groups of drugs that you can choose one from each, but we recommend lifestyle. We think that why take medicines when you can eliminate blood pressure by changing your lifestyle?
Absolutely. Quickly, we are 4 minutes away from the time. Surekha is asking that if the BP value comes down all of a sudden for a person with high BP, is it something of a concern?
Yeah, you should not let your blood pressure drop too low, because then you're going to get lightheaded and dizzy. And that's why I say that sometimes when you titrate these things, it's pretty much a very, very fine titration. And your doctor gives you certain medications, you bring it home, you start taking them. You have to have a blood pressure instrument at home for you to be able to check and see where it's going. If your systolic drops below 100, chances are you're going to get lightheaded and dizzy. So you keep in that range around 120 plus minus 10, 110 to 130, right? So if it goes below 100, your problem. If it goes above 140, your problem. So to keep in the tight window, you have to do what is called titration. To do the titration, you need to do the measurement. To do the measurement, you need to have a good blood pressure instrument at home.
Absolutely. One more question. I think it's very specific. I don't want to take it. Is 60 by 70 BP is normal? I don't think it connects here. So we'll go to the next one quickly, and that's the last one, I think. How BP and triglycerides are related?
So to the extent that I told you, they are both lifestyle disorders. The kind of lifestyle that predisposes you to one predisposes you to the other. But as Naresh said, triglyceride again is a cousin of cholesterol, and we're going to have a separate whole session on lipids. We call them lipids. Cholesterol and triglycerides combined are called lipids. And we'll have a full session on that, and we'll talk about it. But they go hand in hand. Cholesterol, diabetes, blood pressure, heart attack, stroke, some cancer, dementia, chronic kidney disease, all that I mentioned, these 8 lifestyle disorders, they are related.
Absolutely. So that's all the questions, Dr. Sharma, today. And I think it was a great session. And every time I listen to you, I also learn. Today, I could connect the initial session, what you had on the artery and the volume of the blood and the salt. I mean, I could remember my engineering fluid mechanics to a large extent. So that was great. So that was a great learning for me today, even though I've heard you more than, 70, 80 or 100 times, but then still every time it is something which I can pick up from your sessions. So I would request all of us who are still there in the program and on Facebook Live to log into myiwsp.com and look for the program on 16th of January. That's the inaugural session, and then the actual session will be telling you the dates. And those are 12 sessions which Dr. Sharma spoke about, where we will detail out all those what you could get a glimpse of today. And we look forward to all of you joining for that session. So thank you once again, Dr. Sharma. And
Thank you very much. Thank you, everybody. And thank you, Mary. Thank you for a nice comment.
Thank you, Mary. And thank you, everybody. A lot of other comments people have given in the previous comment sections also. So, Naresh, anything from you before we close?
Also request, we see many our alumni are part of this talk. So please share our Facebook live link to, we'll put it in IWSP live group to your known friends and families, so that many people join in and register for next batch. And we'll be doing these talks, multiple talks before our 16th of January session. Continuously, we'll keep you posted and keep joining.
Thank you.
Thank you. Thank you, Dr. Sharma.
Thank you, Dr. Sharma.